Good evening, ladies and gentlemen, and can I just add my welcome to those of my fellow SCI colleagues, and just to thank you so much for spending the evening with us, and to thank you so much for all your support now and hopefully in the future. I'm sorry that our very youngest SCI supporter seems to have had something better to do, so has left us. But what I'm going to very briefly do, because I know that the real part of the evening is for us to be able to get to know you a little bit better, and perhaps you have an opportunity to talk to us and find out a little bit more about SCI from your to the personal perspective. But just to give you a few kind of ideas of our future plans. And I'm just going to start by trying to put that in a little bit of context, which a number of my colleagues have already mentioned, just in terms of the global picture with the WHO roadmap. So Alex said right at the beginning, in 2002, the WHO developed, 2012, sorry, the WHO developed a roadmap, which was really just to try and guide, if you like, the implementing community and all the stakeholders on the steps that we needed to take to reach the goal of elimination of NTDs. And clearly here we're focusing primarily on schistosomiasis, and elimination as a public health problem. So essentially that means that there's no disease, there's very limited burden associated with schistosomiasis. And we've got some very, I think they call them stretch targets for 2015 and 2020. But also, I think very importantly, that by 2020, 75% of all school-age children in need of treatment are treated regularly in all countries where schistosomiasis is prevalent. So, I'm clearly going one way already. Okay. So globally, kind of where are we on that? So for schistosomiasis, we've got 261 million people worldwide who need treatment. And in 2013, we managed to reach slightly less than 50 million. Now, 75% of endemic countries actually do have a national control program. But only 52% of those endemic countries have been fully mapped, and you've been excellently talked through that mapping process by Peter and Fiona. So really, how globally as a community we monitor our progress really was started at the London Declaration, which again Alex mentioned, which was really quite a landmark event which brought together the Director General of the World Health Organization, Bill Gates, and the CEOs of 13 pharmaceutical companies all sitting on the stage together, ministries of health from endemic countries, and also representatives from DFID and the US, who really made a very public commitment to providing the resource and the political will that was needed to reach elimination of these diseases. And it was a community event, if you like, where the majority of stakeholders who were involved in NTDs did participate and sign the London Declaration, which really was just a really formalising of that event. And from that grouping, the Uniting to Combat Neglected Diseases, which is possibly not the catchiest of titles, but was formed, which is seed funded, if you like, by the Gates Foundation. But essentially their real remit was to hold all of the partners to account for progress towards this very challenging target of eliminating these diseases. And so what they developed was an annual scorecard. And so, and I know you've briefly seen this with Fiona, but what it really is a series of milestones and targets that can be followed annually, looking at the components of the programme. So the coverage and impact, looking at the programme support milestones, drug requests, and this is primarily for the drug companies who donate the drugs. The countries request drugs depending on their need, and there's a milestone here of how responsive those drug companies are to the request from countries, and also research, and this is primarily for diseases where elimination targets can't be reached without new treatments or diagnostics. Now, I deliberately hid the schisto one because it actually doesn't look very favourable. You can see that we've got a 3, which is the lowest score, which shows or indicates that there's delayed progress towards target in coverage, and then we've also got delays in programme support and some of the research areas. Now, this really isn't any judgment on the quality of the programmes themselves. It's just really a way of trying to ensure that we're all on track to meet our elimination target. So the reasons that we are in the red, as it were, are really, as we saw right from the beginning, a very low number of treatments. And this here just gives you the coverage, which again you've been very well explained by Fiona and Michelle. So the percentage coverage of the people that need treating in each one of those diseases. And you can see that for schistosomiasis, and it's gone on trachoma, sorry, that schistosomiasis has the lowest coverage rate, and in 2013 we only reached about 16% of all those people requiring treatment. Now you might also think that these figures are a bit old for a report that was only published a few months ago, but obviously all the figures that we use here are the data that's owned by the countries is then given to WHO, who validate that data, and then that's published. So there's obviously a slight lag phase in terms of the data that we have available. But still, we're only at 16% of our coverage. And also, as has been explained, we've got only 52% of those endemic countries are fully mapped. So in those districts where mapping hasn't happened, then the appropriate treatment strategy can't be determined, and so treatment can't be planned and implemented. Now, the good news here is that the Bill and Melinda Gates Foundation have supported the African region WHO office to complete the mapping in Africa, and that's hopefully going to be done by the end of 2015. So hopefully that number will go up from 52% to all endemic districts will be appropriately mapped. And finally, the drugs, and praziquantel, is the drug required for treatment of schistosomiasis, traditionally has been in short supply. Only a very small amount has been donated by Merck, and the majority of it had to be purchased. And as Alex mentioned, Merck has increased their drug donation very significantly, up to 250 million tablets from 2016. So really that is something that is going to significantly impact our progress. So how is SCI then trying to support this global aspirational effort? So in 2010, we developed our strategic plan, which we've got 3 pillars. We've got implementation, research, and capacity building. Now, the implementation in 2010, we had what we thought then was quite a challenging target of 200 million treatments to reach by 2019. And with a little goading from our board, we have increased that now to 300 million tablets. But with the increased donation and the real political will that's been demonstrated, we're really confident that this is an appropriate target. So from 2010 till now, we have delivered 70 million treatments, and so we've only got 230 to go. Now it does seem very ambitious, but when you start to look at how we've begun to scale up, just starting from the time of the strategic plan in 2010, you can see that we really are getting into a position where year on year we are increasing our target. So sorry, the line there is our cumulative target between 2010 and 15, and you can see that's just over 70 million treatments. And when we go back to how that supports the global activity, so on this graph which is from the WHO third report that again Fiona was mentioned before, you can see we've got the number of people treated there on the left and the global coverage there on the right. And of the regions that we treat, so we treat many in the African region and also in Yemen, in the Eastern Mediterranean region. So in 2012, the global treatments for schistosomiasis, 40% of those were in countries that were supported by SCI. So what we have done is we have then taken our country programmes and looked realistically at where we can increase our coverage. And again, the slide that you've already seen from in Peter's presentation, we have worked with our country partners to develop preventative chemotherapy plans out to 2019, looking realistically at what number of treatments can be delivered in each one of those countries to meet that target. And we're also looking to partner with a number of other organisations to deliver treatments in Nigeria, which has the largest schistosomiasis burden of in excess of 16 million people requiring treatment. And we've also worked with our WHO colleagues in the Ministries of Health and Education in Mauritania to deliver treatments that have been donated there. So, the fundraising targets. So, to complete our work in between now, 15-16, so we have our financial years from April to March. We had a fundraising target of 4 million this year, which I'm very pleased to say that we've actually already reached. So we're able to fulfil our commitments and deliver treatments that we've planned until next March. So by then, we hope to have been able to deliver additional treatments, bringing up our cumulative total to 116 million by next year. But that obviously leaves quite a significant number of treatments left. We have until 2019, we have secured funding of about 11 million pounds, and so we're really looking to fundraise in the region of 10 to 20 million pounds per year. Now what we're doing is working very closely with Fiona's team, using the data that is coming out of our value for money activities to really be able to refine down our fundraising targets so that we can really very accurately determine the funds that we require on a year-by-year basis. And although this does seem a really large leap, if again back to what Alex said right at the beginning, so when Alan started the SCI in 2002, we really had one funding source, and now we have a huge amount of financial and in-kind support, and there on the bottom, very importantly, that should be much bigger, is actually the contribution from individuals, which again, as Alex said right at the beginning, was very small when we started, and now is really quite a significant proportion, for which we're enormously grateful. And also, as we work with our in-country partners, again, as Peter mentioned, really this opportunity to try and encourage endemic country governments to allocate part of their funding towards supporting NTDs, and particularly in countries where their natural resources allow a larger proportion of their GDP to support health. So there's a big advocacy job to be done there as well. So just to say that obviously just with the implementation, we've got our number, we've got our 300 million target, but also that we work to ensure that we deliver treatments in the most cost-effective way, and you've been taken through some of the ways that we're continually trying to improve our programs, working with a broad range of in-country and other academic and stakeholder groups. We ensure that we monitor and evaluate our impacts, ensure that we're having value for money, and that we can change our programs as they're underway to ensure that they're as effective as possible. Also, the other part of our strategic plan is research, which again you've heard a lot about today, really with the focus of optimising those strategies and to ensure that we are producing the evidence base that can be used by all our partner organisations. And finally, capacity building, really to deliver on the ground, to deliver research. All these things require a very strong capacity, both within SCI itself and also in our country partners. We have always worked very closely, as you've heard, with our endemic country partners, and really aimed to support existing infrastructures, particularly the existing health systems within countries, and other platforms such as schools and community-based organisations. But the capacity building piece is something that we are really going to be focusing on in the next 12 months, and developing a coherent capacity building strategy, because this is something that we feel is increasingly important. Again, just to acknowledge all of you for sitting so patiently and listening to what we have to say, and your support for us in the numerous ways that you do that, for all our in-country partners, and obviously the most fabulous SCI team. And I am actually just going to leave you with this, which always strikes me very strongly, that really, as Alex said, the word of mouth is really the most effective way of getting the message out there. And we thank you very much for multiplying what we say by 50. Thank you.